Hello, my name is Greg. I'm going to be your nurse practitioner today. Can you please tell me your name?
Sarah.
Okay, I'm going to practice hand hygiene. All right, now I'm going to do a assessment on you. All right, I'm going to look at the patient's head. Head is normal cephalic, no signs of trauma, atraumatic. I'm going to palpate any signs of tenderness.
No.
No tenderness. All right, no masses or lesions noted. The hair is soft, full, no signs of alopecia noted, right? Now I'm going to look at the patient's face. The face is symmetrical, no signs of lesions, mass, scars, or any swelling noted. I'm going to also palpate the temporal pulse. Pulse is present +2 bilaterally. Do you feel any pain?
No.
All right. And okay, now I'm gonna move over and I'm gonna look at the patient's eyebrows. The eyebrows are set evenly, bilaterally, well groomed. I'm gonna also ask patient to hold this out and read the smallest line. Read 14. Read the smallest line. Close one eye and read the smallest line.
LTFPH.
Now switch.
LTFPH.
All right, wonderful. Visual acuity 20/20 bilaterally. Now I'm gonna look at the patient's eyes. They're both set evenly. There's no signs of drainage in any of the glands. I'm gonna look at the conjunctiva. All right, conjunctiva are pink, moist, unremarkable. The scleras are white. The iris are brown, round. The cornea is clear, no signs of abrasion noted to the cornea. Now I'm gonna check for, and also the medial canthus, lateral canthus, no sign of drainage noted. Now I'm gonna look at your eye. Can you open your eye? Pupils equal, round and reactive, bilaterally. Now I'm gonna ask you to look away. Look away, please. All right. Now look at my pen light. Just follow me, please. All right. Pupils constrict, eyes converge, and then now I'm gonna move over and ask you to cover one eye. Cover one eye, and I want you to tell me. I'm gonna check for confrontation. Just tell me what numbers I'm holding up.
2.
Next eye, please.
2.
Okay. Confrontation intact, peripheral vision intact. Now I'm gonna ask you to follow my pen light, right? Don't move your head, just follow my pen light. I'm gonna check for extraocular movement. I'm gonna make an H pattern. Okay, extraocular movement intact. No signs of nystagmus noted. Now I'm gonna do a fundoscopic examination. I'm gonna check your eyes, okay? Now I'm gonna turn off the lights and I'm gonna look. Red light reflex intact. No signs of AV nicking. No signs of papillary edema. Macula intact. I'm gonna look at the next eye. Red light reflex intact, no signs of AV nicking, no signs of papillary edema, macula intact, opacity negative. Now I'm gonna do that. All right, the eyes are good. Now I'm gonna move over and I'm gonna look at the nose. The nose is symmetrical. Any pain in the nose?
No.
No pain. Okay, wonderful. Now I'm gonna ask you to cover near. Breathe out. Breathe out. Okay, wonderful. All right, smell is intact. I'm gonna ask you to smell this. What do you smell?
Vanilla.
Wonderful, wonderful. Now I'm gonna ask you to tilt your head up. All right. Nasal mucosa pink, pink, moist, unremarkable. No signs of perforation. No signs of drainage. No signs of perforation, septal deviation, polyps. No signs of that. All right. Now I'm gonna look at the patient, and now I'm gonna palpate the maxillary sinus. Any pain?
No.
Frontal sinus. Any pain?
No.
Wonderful. Now I'm gonna go look at the lips. The lips are pink. No signs of lesions or anything on the lips. I'm gonna ask you to open your mouth. Open the mouth. Look at your teeth. Smile for me. Teeth intact. I'm gonna ask you all the way. Buccal mucosa is pink, moist, unremarkable. Look under your tongue. Under the tongue is fine. Open your mouth. Tongue down. Hard and soft palate's intact. Tongue is midline. Uvula is midline. The tonsils are +1. No signs of exudate noted. We're gonna move over now to the ears. I'm going to look at the ear, and the ears are set bilaterally at the same level. No, as I'm looking, I don't see any signs of edema noted to the ear. I'm gonna palpate. Do you any pain?
No.
Palpate the tragus. I'm gonna go to mastoid. Any pain?
No.
Bilaterally, no pain. Okay. Now I'm going to ask you to. Which ear am I with?
The right ear. Left ear.
Wonderful, intact. All right, wonderful. Now I'm gonna look into the ear. As an adult, you're gonna go up and back. I'm gonna go in, look up and back. No signs of perforation, no signs of redness, no signs of drainage, no signs of cerumen. The temporal membrane is pearly gray. Cone of light on the right side is 5 o'clock. I'm gonna go over to the left side. The left side. All right, no sign of drainage, perforation, cerumen, and the cone of light, the temporal membrane is pearly gray, and temporal cone of light is 7 o'clock. On the left, now I'm gonna move over, and I'm gonna do the Weber attempt to assess the Weber. Okay, now I'm gonna tell me where you hear it. You hear it in both ears. Okay, all right.
Both ears.
Okay, wonderful. Now I'm gonna go and you tell me when you stop hearing it and when you hear it.
Stop. Hearing.
All right, wonderful. Next side.
Stop. Hearing it.
Wonderful. Hearing intact bilaterally with the Weber. Now I'm gonna move over. I'm gonna look at the neck. The neck. I'm gonna palpate the neck. Wonderful. No signs of lesions, no signs of tenderness noted to the neck. I'm gonna go submental. I'm gonna go submandibular. I'm gonna go tonsil. I'm gonna go pre-auricle. I'm gonna go post-auricle. I'm gonna go occipital. I'm gonna go anterior cervical. I'm gonna posterior cervical, the chains. I'm going supraclavicular. Now, I'm also gonna palpate the thyroid. Do you feel any pain?
No.
When I palpate? All
No.
right, thyroid is intact, no signs of goiter, abnormality, hardened nodules noted to the thyroid. Now I'm gonna go and I'm gonna make sure patient is modesty is maintained. I'm gonna look at the chest. The chest is symmetrical, no signs of lesions, no signs of masses noted to the chest. Patient is breathing 14 breaths per minute, unlabored. Unlabored. Okay, now I'm going to palpate. I don't see any abnormalities. Wonderful. AP ratio is 1:2. No abnormality there. Palpation, no abnormality. Now I'm going to percuss. All right. All right. Percussion, resonance, no abnormality. Now I'm going to auscultate all fields. Take a deep breath. Take a deep breath. Deep breath. Deep breath. Wonderful. Vesicular lung signs heard in all fields, no abnormalities. Now I'm going to go over and I'm going to go to, I'm just going to ask you to turn, please. All right, turn. I'm going to go to the posterior. No abnormalities noted. To the back, no masses, no lesions. No masses, no lesions. I'm going to palpate. No masses or lesions noted. There. Now I'm gonna do tactile firmatives. Can you say 99?
99. 99. 99. 99. 99.
Okay. Tactile firmatives is no signs of consolidation noted. And now I'm going to percuss. Percuss. Percussion is normal. All right, resonance in all lung fields. Now I'm gonna go over and I'm going to check for, just take a deep breath of me. Deep breath, wonderful. Bilateral, chest expansion, bilateral, wonderful. Now I'm going to check for diaphragmatic excursion. I'm going to ask you to take a deep breath and hold. There. Now exhale. Now I'm going to ask you to take a deep breath and hold out and exhale out and hold. All right, wonderful right there. 5. Now I'm going to auscultate all lung fields. Take a deep breath. All right, wonderful. Vesicular lung sounds heard in all fields. No abnormality. Thank you.